Thank you. Now, even as private hospitals have been enrolled to treat COVID-19 patients, the big question now is how much will treatment cost at these private hospitals? With the kind of infrastructure required to prepare and isolate infected patients, the treatment in private hospitals is going to be very costly, expensive, and of course, out of bounds for those common man. Take a look at this special report by India Today.
The government has roped in private hospitals to fight coronavirus. But is the treatment affordable? India Today's reality check shows treatment at a super specialty hospital can leave a big hole in your pocket. A super specialty hospital charges approximately rupees 4,000 for a bed. Add COVID expenses, it will be 11,000 per day in a general ward. For 10 days, it will cost approx rupees 1,10,000 and rupees 1,54,000 for 14 days per patient. In intensive care unit, the cost comes to around 20,000 rupees a bed. Add expenses of PPE gear for medical staff and other expenses, it will cost almost 50,000 rupees per day. For 15 days, it could cost 7,50,000 rupees. With ventilator, the cost could go up even further. That means a super specialty hospital is out of bounds for the common man. This cost is only for one person. If there are multiple family members to be admitted, the cost will multiply.
As per the government guidelines, the bed charges are fixed at around 4,000 rupees a day, and with other charges, it should come in the range of between 11 to 12,000 rupees a day. And some estimates say that a patient may have to stay between 10 to 14 days in a hospital.
On one hand, the private hospitals will really boost the number of beds that the Indian healthcare system can really provide. If you take the example of Delhi, a total of 3 crore population of Delhi would only require almost 3,000 beds, and Delhi has 7,000 beds. That really means that national capital is not that big a concern. The real concern is in the smaller towns and rural India.
A general private hospital could be much cheaper than a super specialty. General ward would cost 5,000 approximately a day. With ventilator and ICU, the cost would add rupees 10,000 a day or 1 lakh for 10 days.
The general bed in an average hospital will cost 2,000 rupees per day, while ICU in the average general hospital will cost 7,000 rupees, whereas with the ventilator the cost will go to 10,000 rupees.
The government of India has issued specific guidelines to the private sector for the treatment of COVID-19 patients. Private hospitals will need to ensure that extreme caution is exercised and an Italy-like situation does not arise, where hospitals turn into hotspots for spreading this highly contagious disease. With video journalist Sanjeev, this is Mosmi Singh.